Hello, everyone. Welcome to this episode of In the Know. So we've got a bit of a focus on men's health topics, and we're going to focus particularly on AAA screening, which is abdominal aortic aneurysm screening, but we'll call it AAA because nobody wants to say that repeatedly. So just before we start, I'll introduce myself, and then if you can introduce yourself. So I'm Dr. Sarah McNulty. I'm the Director of Public Health for Knowsley. I work for Knowsley Council.
I'm Alan Ward. I'm a patient at Dr. Mozzarani in Kirby.
My name's Joe Jenkins. I'm one of the physician associates working as a long-term condition clinician at Primary Care Knowsley.
So an abdominal aortic aneurysm. So essentially, your abdominal aorta is your aorta is your big blood vessel that carries blood all around your body. Your abdominal bit is where it passes through your stomach, and an aneurysm. So, Joe, do you want to tell us what an aneurysm is?
Yeah, so an aneurysm is something that can happen as a result of, it can be genetic factors, but can also be some lifestyle factors to it. But it's effectively where the wall of a blood vessel becomes weaker, and as a result of which it starts to bulge outwards as a result of that, which can therefore increase your risk of having ruptures of that. And of course, because of the abdominal aorta and how big it is, it's a medical emergency if it did rupture, which is why we take it so seriously and try to screen for it so that we can prevent it happening. If that was something that a patient may be at risk of.
Yeah. So this is a screening program for men in particular, and the reason why it's for men is because men are more likely than women to have a rupture of this big blood vessel, which, like you say, can be catastrophic if it ruptures. But actually, it doesn't just develop overnight, does it?
No, definitely not. No. So the screening programs for any man over 65, sometimes they may find something incidentally as well. It may be found as a result of other scans. So, for example, with my own father, he's currently got around about a medium-sized, which we'll talk about in a moment, medium-sized abdominal aortic aneurysm at the moment. So he's currently undergoing monitoring for that, but his was found as a result of another scan that he had done. Now, should we go into? We'll crack on. So with this program, of course, when you get called for, it's primarily done so through either a letter or, of course, an email sent to the patient. It's normally done. It's a process that's normally conducted in the community, but can also be in the hospital too. So depending on what availability there is for those patients and where the ultrasound practitioners may be, which of course brings me on to how we do it. So, as we mentioned earlier, of course, this is around the abdomen. It's not an invasive test. It takes about 10 to 15 minutes. Liken it a bit to if you've, a pregnancy ultrasound scan. Bit of jelly on the stomach, and of course, a probe going on the stomach. Non-invasive, shouldn't be painful at all. So it shouldn't be something that men could get too concerned about. Exactly, yeah. As I say, it takes about 10 to 15 minutes, and we're effectively measuring the size of the abdominal aorta. Now, there's multiple different things that can cause it to get bigger, but I think that, first of all, it's important to know the different types or what we might do in each different eventuality. So depending on how big the aorta is, they define them as small, medium and large, and I won't bore you too much with the details on what that defined as. But with small, it's a yearly an annual monitoring with small abdominal aortas, AAA, should we say? It's like a tongue twister, isn't it? For medium, it's 3 monthly. You have these checks, and then for large, I think it's over 5.5 centimetres for that one. Then that's normally referred to the vascular surgeon as well. Simultaneously, however, of course, we want to act prior to something bad happening, and of course a rupture, because of course just because we've detected it doesn't mean that there may not be an impending medical issue as a result of that. So the best thing that we can do in primary care is to manage the risk factors of that, to give someone the highest possible chances of a long and happy life. So these things might be blood pressure, which is the main one. Most patients that I mean, in my job, I see many patients with raised blood pressure. Some people don't even realise that they have it, which is why it's a silent killer. Yeah. Things like smoking is another one. Of course, smoking leads to inflammation in the body, and that inflammation can contribute to the AAA. But also other things like diabetes, getting that under control. Of course, kidney issues as well, also to get under control. Of course, this can lead to all kind of follow on to impact your blood pressure too.
So
Yeah, I think I had it done about maybe 3 years ago now.
okay,
And like Joe said, it's just getting a bit of jelly on your stomach, and they scan it and everything was fine, and I've heard no more since. So
yeah. And because it develops over a long period of time, that screen means that actually, you should be reassured that there isn't something that's going to burst at some point.
Yeah.
And actually, if it was big, like you say, you'd either be monitored or you'd get a referral to a vascular surgeon, and then they'd go through kind of pros and cons of getting an operation that would reduce again your risk, because the one thing that you don't want is for it to rupture out of the blue when we know that there's a really high death rate from that happening.
And of course, in addition to that as well, patients on things like warfarin, things like apixabans and the edoxabans, all these blood thinning medications, of course, these patients as well would be especially at high risk of rupture. So, of course, even though it might be defined as a large AAA, that's only so. Of course, the research into that would be that it's deemed that that's large, and there's an appropriate amount of time between when it's found to when it should be treated that should be followed for every patient as well. So even though you may be worried to find out that it's large, it still should be in hand with a vascular surgeon. I think from a patient's perspective, the only thing that I would be making sure that you do is keeping on top to make sure that you've been referred if that was the case, and of course asking questions to your GP if anything's not clear.
Yeah. So is there any indication that there could be something wrong without having a scan?
I would say that the risk factors could. I think that the main indication would be that there's different, as we mentioned earlier, about things like your blood pressure and smoking. There's things that make you more likely to have it. But as far as symptoms go, I'm not sure if you disagree. But I don't think that there is anything that would really.
So it would be kind of risk factors. I mean, some people will be able to see it if it's big enough. You would see a pulsatile kind of mass in your stomach, and that can happen. And if you have ones in your neck, you can see that as well. But they would have to get pretty big for you to be able to see something like that. But it's kind of the risk factors are more the things that you'd be looking at. So it's absolutely another one of the many, many reasons to not smoke and to get your blood pressure checked and under control and all of that stuff. I think if it was to start leaking or be on the verge of a rupture, then you may experience pain, or you may collapse, or you'd start to feel unwell. And so again, we've talked before about knowing your body and knowing and seeking help. If you collapse, feel dizzy, anything like that. But I mean, it's like I say, just another reason to take good care of yourself and to get checked out. And like you say, simple test. Looking, but actually could definitely save a life.
Save your life,
Save your life, So I guess, if there's any take-home messages from this, what would it be?
For me, it'd be if you get after it, take it, get it done. It's simple, just easy, and it could save your life like all the others. Get it done.
And I think that prevention is better than cure as well. Of course, while it's easy to be reactive to situations and to have these tests and the screening process is done and of course react appropriately to them, the best thing that we can do is of course optimize ourselves so that it doesn't happen in the future. So as you mentioned, not to smoke, and of course attending these health check appointments that that may be discussed on a later podcast, but attending these appointments so that you've got the information about your body. So of course, if by the time I get to 40 odd, I'll probably want to start doing this myself on a regular basis. Not that I don't check myself already, but of course, if there is an issue, not to bury your head in the sand about it and to face it head on. Of course, I can speak for my own practice. I'm not going to bite. We talk about this we talk about medical issues like this all the time with patients, and it's not something that I would say that someone needs to be embarrassed to talk about. And it's, as like you say, it's something that could save your life quite easily.
And like you say, if you get the invite, so we know probably in Knowsley about just over 1 in 5 men won't go for the test, which is you know, it doesn't sound like a lot, but actually, you know, it is a simple test. It doesn't take long, and the benefits of it.
And I think as well, just to kind of bring it back to my own father, his was, I think, if I remember correctly, his was about 49 milli, so 4.9 centimetres. As I say, 5.5 is technically large. He feels completely fine himself. If you were to ask him, he says the healthiest he's ever been. It's not and in addition to that as well, he's happy knowing that this is being checked on a regular basis. I think that ignorance is not bliss in this sort of situation. So for him, at least, he's from what I can tell, at least he seems to be very happy that this is getting picked up on
monitored,
and monitored. Because we don't want to see him go anytime soon.
No, you don't.
Okay, thank you very much.
Thank you very much.
Thank you very much.